Parkinson's disease is a neurological disorder that affects movement. One of the primary symptoms of Parkinson's is tremors, but there are other features that doctors use to diagnose and track the progression of the disease. Other symptoms of Parkinson's disease include stiffness, slow movement, and difficulty with balance and coordination. Additionally, the disease can also cause non-motor symptoms such as depression, anxiety, and sleep disturbances. In this video, we will explore several features of Parkinson's disease, including motor uptures, total uptures, jitter, shimmer, NHR, H&R, RPDE, DFA, and PPE. Motor uptures stands for the Unified Parkinson's Disease Rating Scale, which is a tool that doctors use to assess the severity of motor symptoms in Parkinson's patients. The score ranges from 0 to 108, with higher scores indicating more severe symptoms. Some of the factors that the motor uptures takes into account include tremors, rigidity, bradykinesia, slow movement, and postural instability. The motor uptures is commonly used in clinical trials and research studies to assess the effectiveness of treatments for Parkinson's disease. It typically takes 20 to 30 minutes to administer, and a qualified healthcare professional does so. The total uptures score is similar to the motor uptures score, but it also includes symptoms that aren't related to movement, such as problems with thinking, mood, and sleep. The total uptures score ranges from 0 to 176, with higher scores showing more severe symptoms. Jitter is a measure of the variability in the time between successive vocalizations. There are several different types of jitter measurements, including jitter, percent, jitter, ABS, jitter rap, jitter PPQ-5, and jitter DDP. These measurements can help doctors diagnose and track the progression of Parkinson's disease, as they can be affected by tremors and other motor symptoms. Jitter measurements are commonly used in electromyography, EMG, tests to evaluate muscle activity and nerve conduction. They can also be used to diagnose and monitor other neurological conditions, such as multiple sclerosis and myasthenia gravis. Shimmer is a measure of the variability in the amplitude or intensity of vocalizations. Like jitter, there are several different types of shimmer measurements, including shimmer, dB, shimmer, AP3, shimmer, AP5, shimmer, AP11, and shimmer DDA. These measurements can also be affected by tremors and other motor symptoms. Shimmer measurements are commonly used to assess voice disorders and can provide valuable information about the stability of a person's voice. However, it is important to consider other factors that may impact these measurements, such as medication use or underlying medical conditions. NHR stands for the ratio of noise to harmonic components in a vocalization. Higher NHR values can indicate increased breathiness or hoarseness in the voice, which can be a symptom of Parkinson's disease. NHR analysis has been used in clinical settings to aid in the early detection of Parkinson's disease. However, it is important to note that other factors, such as age and smoking, can also affect NHR values. H&R stands for the harmonic to noise ratio, which is a measure of the ratio of harmonic components to noise in a vocalization. Lower H&R values can show that a person's voice is getting more breathy or hoarse, which can be a sign of Parkinson's disease. RPDE stands for the recurrence period density entropy, which is a measure of the predictability of a person's movements. People with Parkinson's disease tend to have lower RPDE values, which can mean that their movements are becoming less flexible and more rigid. RPDE is a useful tool for tracking how Parkinson's disease gets worse and figuring out how well treatments work. It can also be used to differentiate between Parkinson's disease and other movement disorders. DFA stands for Detrended Fluctuation Analysis, which is a measure of the long-term correlations in a person's movements. People with Parkinson's disease tend to have higher DFA values, which can indicate increased randomness and decreased predictability in movement. PPE stands for pitch period entropy, which is a measure of the variability in the pitch of a person's voice. People with Parkinson's disease tend to have higher PPE values, which can indicate increased difficulty controlling the pitch of their voice. In conclusion, Parkinson's disease is a complex disorder that can affect many different aspects of a person's life. The features we've discussed in this video, including motor obturs, total obturs, jitter, shimmer, NHR, H&R, RPDE, DFA, and PPE, can all provide valuable information for doctors trying to diagnose and treat Parkinson's disease. It is important for individuals who suspect they may have Parkinson's disease to seek medical attention and receive a proper diagnosis. Early detection and treatment can help manage symptoms and improve the quality of life.